A very good morning to all of our viewers. Welcome to our YouTube channel Spectra. I'm your host, Dr. Mani Iyer, and we are welcome back to the channel. And as parents, one question often comes up: is my child developing normally? Sometimes it's delayed speech, limited eye contact, frequent anger, difficulty focusing, or behaviors that leave parents wondering. Is this just a phase or something I should pay attention to? In today's episode, we'll talk about early child development, signs parents should not ignore, early signs of autism, and attention deficit slash hyperactivity disorder across the lifespan, emotional and behavioral concerns, and simple practical strategies that can help at home. Because early identification is not just about diagnosis, it can truly shape a child's future. To guide us through this process, to this very important conversation, we have with us Miss Ekamjeet Kaur. She is a renowned clinical psychologist and psychotherapist, founder of Balm of Mind, a child development and mental health clinic. She holds a Master of Philosophy in Clinical Psychology from the Government Medical College and Hospital in Chandigarh, Sector 32, with specialized training in child psychology. She has actively worked in autism awareness, child psychology, and neuropsychology, and has presented her research at international, national, and international publications and conferences, including NIMHANS Bangalore and in Lisbon, Portugal. Now I invite Miss Ekamjeet Kaurji to take over this conversation. Over to you, Ekamji.
Thank you so much, Dr. Mani, for that kind introduction. And thank you for having me on your YouTube channel. And I must truly appreciate the work you are doing in spreading mental health awareness and conversations like these, which are so important. And a big thank you to everyone who has joined us today and chosen to spend their time with us. It means a lot. So, welcome everyone. So, yeah, without any further delay, let's start with our today's topic that is very much deeply relevant to almost every parent, teacher, and caregiver. Is my child developing normally? So let me share a presentation with you so that it becomes easier for you all. Yeah, are you able to see my screen?
Yes.
Yes. So is my child developing normally? Now, this may sound like a simple question, but behind this, it lies so much confusion, fear, and uncertainty. हम कभी ना कभी हर एक पेरेंट ने एट सम मोमेंट ऑफ देयर लाइफ सोचा होगा इधर एट 3 a.m. और समटाइम्स क्वाइटली कि क्या मेरा बच्चा नॉर्मली डेवलप कर रहा है क्यों क्योंकि कई बार लगता है कि क्यों मेरा चाइल्ड अभी तक बोल नहीं रहा है आई कांटेक्ट नहीं मेंटेन कर रहा है बड़ा रेस्टलेस सा रहता है और फिर एक थॉट आता है कि एम आई ओवर थिंकिंग और देयर समथिंग रियली गोइंग ऑन and the interesting part is that research shows that there is a good amount of time period between when the parent notices the first symptom and between the time they seek help. And the gap between these two is very crucial. So, the aim of the session today is to provide you awareness so that this gap, the anxiety, the confusion, it can be replaced with awareness and further awareness with action. So we hope by the end of the session, you will know what exactly to look for, when to act, and why.
Yeah.
So,
Yeah. So, what will we be covering today, and what is the child development really?
yes. So we will be covering today, sir. I have prepared a roadmap. We'll be covering what is exactly child development. Before understanding the red flags, we should know what it is exactly, and then what are the red flags, why it matters, why early intervention is so important. Then domain-wise, we'll see what are the red flags in motor, speech, social, play, and then I'll be busting some myths. We'll be replacing with facts, and lastly, we'll be introducing our next series for the YouTube channel and a very important take home message for the audience.
Yeah. What is child development really, AMG?
Yes. So, first thing first, starting with what is exactly child development. So, when we talk about child development, it's not just about height and weight. It's also about how your child develops emotionally, that is, regulating their feelings, attachment, security, also socially, that is, connecting, sharing, relating to others, and then obviously cognitively, his thinking, problem solving, memory, and the most important, the language learning, the understanding and the expressing communication. And the fun fact, do you know that the brain develops fastest in the first 1,000 days? It is approx 2.7 years. So that's why it's very, very important. And now you might be wondering that from exactly where the child development begins, right? So child development begins, it might be surprising for some people that it begins before the birth only. Child development, it starts in the womb only. The brain, the nervous system, all of this starts developing and forming during the pregnancy itself. In fact, the prenatal factors that we are going to discuss, they are the most sensitive phases of the development. So now I'll be giving you examples that why these prenatal factors are so important and how they contribute to the child development even before the birth of the baby. For example, starting with the maternal nutrition. So you can think of this like building a house. If the foundation doesn't get the proper material, the structure can weaken. If the mother has any deficiency, it might be vitamin D, folic acid, or any other protein, the baby's brain development, growth, and even later learning disabilities and development can impact. So examples, researchers have shown that how severe folic acid deficiency can increase the risk of neural tube defects. And then again, stress. ये हमें सबको पता है, it's widely talked about that stress, how it harms the child development and contributes to the defectiveness in the child development, but it's not directly causing. कुछ ऐसा नहीं कि stress हुआ उसके बाद पक्का ऐसी चीजें होने ही लगेंगी. जो stress होता है in the pregnancy, it might be domestic violence, anxiety, or any other emotional distress. It creates a vulnerability that it can increase the risk of developing certain disorders, right? And because why? Because stress increases the mother's stress hormone, that is cortisol, which is not healthy for the mother. Then substances might be alcohol or smoking. They are the major risk factors. During pregnancy, any type of exposure to substances can harm the child's brain development. For example, there's the disorders also known as fetal alcohol syndrome. ये कब होता है? While during the pregnancy, mother consumed the alcohol, right? So which can lead to lifelong cognitive and behavioral difficulties. So it's better to prevent it. And then coming infections, which child can have from mother and then later can present with difficulties or developmental delays. Then thyroid. This is the most underrated thing. People underestimate that, but a mother's thyroid hormones are very important for the baby's development. Thyroid is one of the factors, preventable factors for even the intellectual disability. If the child is getting uh, is regular checkups with their pediatrician, and the pediatrician is managing the thyroid symptoms with medication, so we can even prevent the intellectual disability thing. It's a preventable factor, but under noticed. And then again, diabetes can relate to birth complications and developmental vulnerabilities and certain medications. Not every medication, but there are certain medications that are not safe during the pregnancy. So that's why it's important not to take any medication without consultation from your physician. So when we talk about all these these prenatal factors related to developmental, we are not blaming the mother. They are the preventable things. If mother is aware that these are the things that can contribute to my child development, we can save that crucial part for the baby's growth, right? So the question is not to just blame the mother, it's to provide the awareness to mothers. And then what shapes exactly the development? We can understand this by biopsychosocial model. This model explains that child development is influenced by their biology, psychology, and social environment. This means that the child growth can be affected by their physical, emotional well-being, and the relationship that they have with others. For example, अगर कोई बच्चा बीमार है, they are sick, they will not able to play as much, they will not able to get that exposure, therefore uh, they might get slow in their development, right? And same other ways, अगर बच्चे को exposure नहीं मिल रहा, there is stress in the home, mother के साथ relation अच्छा नहीं है, तो might be he get delays in the other thing. So it's very interactive between them, the biology, the psychology, and the social environment, and these three in combination shapes the development of the child. And this is also a famous saying that a baby's this for example, serve and return interaction builds neural pathway. How? For example, your baby serves you, right? It presents you a first action that, okay, mama, I need this, or he may be presenting you, points to a rattle or poos to you. Then, if the adult properly returns, that is the serve. They serve with proper attention, eye contact, and words. They might be strengthening their neural pathways. So it's very important जब आपका बच्चा छोटा होते कुछ भी आपको reactions दे रहा है, so it's very important as a caregiver we serve that reaction so that it brings the neuron pathways activated, which allow the child for language acquisition, emotional regulation, and executive functioning. So I
Ekam ji,
hope I'm clear till then.
yeah, Ekam ji, what should parents watch and how should they watch?
Yeah. So coming to what parents exactly should watch is that they should observe across the settings. नॉट कि बस घर पे वो बच्चा क्या कर रहा है. ऑलवेज जो असेसमेंट होती है वो मल्टीपल डोमेन्स पे होती है. घर पे क्या सिम्टम्स आ रहे हैं, स्कूल में क्या सिम्टम्स आ रहे हैं, स्ट्रेंजर्स के साथ बच्चा कैसा रिएक्ट कर रहा है. तो द ऑब्जर्वेशन कोई भी सिम्टम की जो हम आगे बात करेंगे रेड फ्लैग्स की, इट शुड बी अक्रॉस द डोमेन. सिर्फ अगर वो घर पे चीज हो रही है, बाहर ऐसा कुछ नहीं हो रहा, तो वी कांट say like say is it a symptom, it might be behavioral symptom or any other. So we have to see the very first thing ki, is my child showing the same sign across the setting, and then consistently. कभी कभी हम भी properly अपने potential जितना नहीं कर पाते. Same goes with child. A single day off is very very normal. पर अगर आपको लग रहा है कि there's a consistent pattern that is continuing over the week, that matters very much. Then, thirdly, important thing is that we have to compare the child with their milestone and corrected age and not other kids. For example, अगर एक बच्चा प्रीमेच्योर बेबी है, राइट, तो उसकी जो हम डेवलपमेंटल माइलस्टोन का कंपैरिजन करेंगे काइंड ऑफ, मतलब कि विल सी if it is developing normally or not, will be their corrected age. अगर बच्चा प्री मेच्योर है बाय 2 months, तो and उसका birth age is now 8 months, but we will see the milestone as per the corrected age, that is 6 months. क्योंकि premature बच्चे take times to develop, right, till their exactly corrected age, but not more than 2 years. Research says that the premature children, they get aligned with their birth age within the 2 years gap. But if still within their corrected age also, अगर बच्चा बहुत ज्यादा delay present कर रहा है, so it is a warning sign that we should consult a pediatrician or physician of the child. Then we have to talk to multiple caregivers. Again, it's just like saying कि across the setting. आपका अगर बच्चा कहीं प्ले करने जाता है, किसी ट्यूशन टीचर के पास जाता है, कहीं भी, then ask for the observation कि how he is presenting there. So these are the things which can parents watch, and they will be very very useful for their treating doctor to know. Yeah,
So you have highlighted these red flags, AKMG. So how do we? So where do it takes us from here? Once we have observed these red flags, what we should do next?
yeah, good question. And when I say red flag, it's not a label, right? I'm not labeling any child. The red flag is itself a sign. It's a sign that you have to seek medical help. अगर आप जाते भी हो डॉक्टर के पास रेड फ्लैग लेके राइट यू सी आपने ये वेबिनार देखा है कुछ भी एंड यू गॉट टू नो कि दिस इज द रेड फ्लैग इट्स नॉट द लेबल गो टू योर डॉक्टर अगर वो कहते हैं अब कि अगर कोई sign है warning sign है then I'll explain you how they will do the assessment but if not at least you will get a reassurance so the main purpose and the awareness is that don't miss the red flags but it's not a label always. It's just that you should seek medical help at that moment. And if there's nothing, doctor will reassure you. But if there's some sign your doctor finds, then early intervention is always recommended. For example, जब आप अपने डॉक्टर के पास जाएंगे, the treating pediatrician, then they will first, हमारे पास भी back of mind whenever a child comes, we first have a physician meet with the psychiatrist, right? They rule out medical conditions if there are. For example, the child is coming with a speech delay, then they might refer to a ENT specialist. This is hearing. If it's not, it's an only in the under one domain, only speech delay is there. Otherwise, everything rest of the milestones are properly appropriately developed. Then we refer to a specialist that is speech therapist. देन उनका इस हर एक डोमेन का टीम का अपना असेसमेंट होता है देन द स्पीच थेरेपिस्ट विल डू देयर डिटेल्ड असेसमेंट राइट and if they need see there is need of the behavioral therapy also and the play therapy also then speech therapist will refer to us to a play therapist they will they their own assessment and I as a clinical psychologist if I think that child needs behavioral therapy I will do my baseline assessment and accordingly will start a multidisciplinary team management for the child. So this is
Y-
how we see when the child comes with a developmental red flag.
Yeah, so I had a small question, Ekamji. So this early intervention, this is definitely very important, as you're saying. So,
Yes.
what makes it so important and what makes it, it's like it works completely.
Yeah. Early intervention is always recommended and it's so important. Why? Because a child's brain is like a soft play, right? When the child is very young, the brain is still making connections very fast. It's learning from everything, from touch, sound, eye contact, play, and relationship. What happens in the very first 5 years, the brain is growing at the very fast speed. And the ability of the brain to change and adapt, we call it neuroplasticity. मतलब सिंपल कि ब्रेन हमारा बहुत फ्लेक्सिबल होता है छोटे होते इन द डेवलपमेंटल एज बहुत फ्लेक्सिबल होता है अडाप्ट जल्दी करता है नई स्किल्स जल्दी सीखता है फॉर एग्जाम्पल अगर सेम एग्जाम्पल बच्चा स्पीच डिले के साथ आया अगर हम उसकी स्पीच थेरेपी 2 years से स्टार्ट करते हैं द ब्रेन इज मोर रेडी टू लर्न दैट वर्ड साउंड एंड कम्युनिकेशन बट वही चीज अगर हम 7 8 पे करेंगे इट लर्निंग कैन स्टिल हैपन बट इट विल टेक मोर टाइम एंड मोर एफर्ट so think of like we are writing on a wet cement that's very easy, and writing on a dry cement is harder. So that's why early intervention is so important. Uh, there is neuroplasticity, and then this concept of pruning. This means कि neural connections जो हमें दिखता है brain को notice होते हैं कि they are not much important. Lose it or use it वाला concept use होता है, then the brain loses that synaptic connections and strengthen those that are much useful. And it happens very rapidly under the age of 5. So that's why we always say that please seek the treatment early. Early intervention is important, and the basis has proper neuroscience. But one thing interesting is that why it got misses that it got miss होता है फॉर एग्जाम्पल दिस सेम एग्जाम्पल कि बच्चे का स्पीच डिले था एट 2 years राइट एंड पेरेंट्स नोटिस उन्होंने कहीं से सुना था और दे आर pretty aware of this thing कि okay this is speech delay. बट कई बार क्या बोलते हैं लोग, अरे कोई बात नहीं, इनका फादर भी लेट ही बोले थे, लड़के तो लेट ही बोलते हैं, इट्स ओके, बट वेट एंड वॉच इज द एडवाइस विच कैन कोस्ट अ प्रेशियस टाइम, राइट? एंड वो बहुत कॉमन, हमारे पास में जब बच्चे आते हैं सबको यही एग्जाम्पल दिया जाता है कि अभी रुक जाओ, इट्स ओके, उनके पेरेंट्स भी लेट बोले थे, होता है, आप ज्यादा टेंशन ले रहे हो. तो अगेन दैट पॉइंट कि नॉट एवरीथिंग इज अ लेबल, बट अगर आपको लग रहा है कि देयर इज अ रेड फ्लैग, देन यू मस्ट मीट योर डॉक्टर. अगर कुछ नहीं, वो दिल रीश्योर यू, पर अगर देयर समथिंग, सम साइन इज देयर, देन वी कैन स्टार्ट थेरेपी टाइमली, राइट? तो आई शुड देन मतलब we should spread awareness for this, that he'll catch up and everything, that we should not follow this advice, it can cost the precious time. बाद में भी लर्निंग हो जाती है, ऐसा नहीं है कि बच्चा 60 साल में आएगा तो नहीं हो पाएगा. ब्रेन नेवर स्टॉप्स लर्निंग, बट द इम्पोर्टेंट इज द टाइम, जहाँ पर न्यूरोप्लास्टिसिटी ज्यादा है, ब्रेन फ्लेक्सिबल है, प्रैक्टिस ज्यादा हो सकती है, लेस फ्रस्ट्रेशन होगी. So that's why it's important to not replace this wait and watch, and to replace with the proper assessment.
Yeah. So thanks for this. Yeah. Now I would like to ask, what are the myths around child development?
Yeah, as we have discussed the pretty one myth that लड़के तो लेट ही बोलते हैं, right? I'll replace them with the researches that I found on the internet, that it sex differences do exist in the early language acquisition, but they are very small. It's not like कि proper genuine delay होगा इन टर्म्स ऑफ द जेंडर, कि बॉयज सब हमेशा लेट ही बोलेंगे या बहुत लेट बोलेंगे, जेन्युइन डिले नहीं होता, इट्स वेरी स्मॉल डिफरेंस दैट इज देयर. बट अगर आपको लग रहा है कि आपके बच्चे में डिले है एज पर द टाइम अप्रोप्रिएट एज, देन यू शुड कंसल्ट योर डॉक्टर रिगार्डलेस ऑफ द जेंडर. देन इट्स कि इट्स जस्ट लेट ब्लूमर, ठीक है, कुछ बच्चे लेट ब्लूम करते हैं, बट द वार्निंग साइन इज, अगर बच्चा अपनी सीखी हुई द लर्न स्किल्स, it's a warning sign, then it's not late blooming. Most importantly, screen time either will cause it or fix it. कि अभी इसका बंद कर देते हैं सारा स्क्रीन एवरीथिंग, फिर ये बिल्कुल ठीक हो जाएगा. ओके, स्क्रीन टाइम अफेक्ट्स, इट वेरी मच अफेक्ट्स, because it's a one way communication, it affects the language exposure and the child development of the brain, but it's not a standalone treatment, right? It can increase the vulnerability. अगर बच्चे में ऑलरेडी एक जेनेटिक वर्नेबिलिटी है टू हैव ऑटिज्म, और ऊपर से हमने लाइफस्टाइल ऐड कर दिया विद द ग्रेट स्क्रीन टाइम, देन बच्चा कैन लीड टू ऑटिज्म स्पेक्ट्रम डिसऑर्डर. बट सिर्फ उसको फिक्स करने से ऐसा नहीं कि सब कुछ ही फिक्स हो जाएगा, राइट? दैट्स इंपॉर्टेंट फैक्टर. So that's what we see. And also the eye contact, right? कि कभी कभी देता है, inconsistent है. Again, eye contact is a very big major sign and a predictor for the communication and the social reciprocation. तो अगर आपको लग रहा है कि inconsistent eye contact है, again same theory, अगर कुछ भी नहीं होगा doctor will reassure you, but as a parent you should meet your doctor early if you think there's any uh, red flags present.
Yeah. You have talked about various red flags, but can you please tell us domain by domain what are the real red flags?
Yes, I'll present the domain by domain red flags so that it's easier for us to understand what we all are talking about. So, starting with first thing first, that is motor development. Motor development means how the child uses their body, how they sit, they crawl, walk, run, hold objects. और ये motor development is the first visible signs, right, that the parents usually notice. फॉर एग्जाम्पल, सबसे पहले बच्चा क्या सीखता है? हेड कंट्रोल करना, देन बैठना, देन क्रॉल करना, देन स्टैंडिंग एंड देन वॉकिंग, एंड दिस सीक्वेंस एक्चुअली मैटर्स. तो अगर आपको लगता है देयर इज अ डिले इन दिस, इट नीड्स एन अटेंशन एंड एन असेसमेंट. फॉर एग्जाम्पल, बाय 9 months the child should be able to sit without the support, so we have to observe carefully, because why? Sitting shows the core strength, balance and brain body this coordination. And if the child is not walking by 18 months, again, this is an important sign. It's not like the child is lazy or something. He should be able to walk by 18 months or plus minus 2 months. Then sometimes it may be due to muscle tone, but most of the time it is due to developmental delay. Another thing here in the motor development that the parents miss is the toe walking. If it's occasional, it's okay. But if it's persistent, toe walking is itself a red flag. It can sign to autism spectrum disorders and other developmental delays. So if toe walking is present persistently, then a parent should take the consultation from the doctor. Then another red flag is using only one side of the body, right? Just dragging one leg. This can sometimes indicate motor weakness. Lastly, सबसे important, the loss of skill. It matters in every milestone. अगर कुछ भी skill का loss हुआ, it can link to regression and it should not be ignored. बच्चे ने पहले बैठना सीख लिया, सब कुछ करना सीख लिया, now unstable हो गया, that it should warrant immediate assessment. Then coming quickly to the speech milestones. So communication starts even before the words. And communication is not just about the conversations we are doing, right? It's about eye contact, gesture, pointing, and babbling, right? So, for example, by 12 months, the child is expected to babble like Baba, Mama, and around 16 months, he or she should produce some meaningful words like Mama, Papa, water, bowl. If it's not there till 16 months, so it's worth assessing once. And then another red flag in the speech domain is the child is not able to combine two words by 2 years. For example, Mama idhar aao, पानी दे दो, टू वर्ड्स को कंबाइन करके नहीं बोल पा रहा है, आइसोलेटेड वर्ड्स ही हैं, राइट? सो दिस इज अगेन वन ऑफ द रेड फ्लैग. एंड इम्पॉर्टेंट रेड फ्लैग हियर इज नॉट रिस्पॉन्डिंग टू नेम. आपने हियरिंग चेक करा लिया बच्चे का, ईएनटी ने क्लियर कर दिया, देयर इज नो इशू, still the child is not responding to your responding to his name and they don't turn, then it's a red flag. अगेन जैसे हमने लास्ट उसमें डिस्कस किया, देयर इज द लॉस ऑफ एनी स्किल. बच्चे ने पहले बोलना स्टार्ट किया था, ऑटिज्म में काफी कई बार कॉमन होता है, रिग्रेशन के केसेस आते हैं, बच्चे ने पहले बोलना सीखा था एंड देन दे रिग्रेस, दे जस्ट स्टॉप, right? And this regression should always be evaluated. Then, as we said, child development is not just about motor and speech, it's also about the social development. That is how a child connects with people. And this starts very early, even before the birth. For example, अगर 2 महीने का बच्चा है, he or she will be able to smile you back. By 9 months, the child uh, will look at the parent's face while feeding or anything. And by 1 year, the child will point to show something exciting. The joint attention is the biggest predictor of the social communication. It's very, very important. We'll talk about the joint attention in detail further. एंड द रेड फ्लैग्स फॉर द सेम इज कि अगर बच्चे का बहुत कम या बिल्कुल ही आई कांटेक्ट नहीं है, वाइल प्लेइंग और फीडिंग बच्चा बिल्कुल आई कांटेक्ट नहीं मेंटेन कर रहा है, और अपने इंटरेस्ट नहीं आपको दिखा रहा है, कुछ भी नहीं, कुछ भी जा रहा है बाहर, एयरप्लेन जा रहा है, बर्ड जा रहा है, पहली बार उसने वो चीज देखी है, फिर भी कुछ इंटरेस्ट नहीं आपके साथ शोइंग कर रहा, जॉइंट अटेंशन बिल्कुल नहीं है, दिस इज अ बिग डेवलपमेंटल स्किल, दैट इज जॉइंट अटेंशन. Then he's not noticing the other emotions or not responding to that. मम्मा रो रही है उसकी, या साइड में बच्चे कुछ भी एक्टिंग कर रहे हैं फॉर दैट प्ले मैटर, बट ही इज नॉट रिस्पॉन्डिंग अप्रोप्रिएटली. देन टूवर्ड्स सेपरेशन, either he is giving too much reactions or not at all. That's an attachment thing that we can look for, how the child is developing attachment wise. And the perfect way to see is through play. Play is not just ऐसे बस खेलना, it's how your children think, imagine, problem solve, and understand the words, right? And as a psychologist, we learn so much about the child by watching their play. For example, the child is feeding a doll, pretending to cook, pretending a phone call. This is a healthy pretend play. And by around 2 years, we expect some symbolic play. Symbolic playing, for example, I'll just use this AC remote as a phone and I'll pretend, hello, mama ghar aa I'll just pretend it, right, with some other objects. Then it's very important that the child learns the symbolic play by at least 2 years. And if the play is very repetitive, it can be a red flag. The child is just lining up the cars, not showing interest in otherwise. There are restricted play patterns. एक ही चीज में just opening, closing doors for long periods. That can be a red flag and should warrant assessment. Not because repetition is bad, but because play should be expanded after a certain point of age. And then not playing with the peers. Parallel play, that is कि बच्चे साथ में बैठे हैं पर अपना अपना खेल रहे हैं, we can expect that by at least 4-5 years. पर उसके बाद the child should learn cooperative play. कि अब हम अगर 4-5 बच्चे इकट्ठे बैठे हैं तो they are playing cooperatively, कोई गेम प्ले कर रहे हैं, राइट, इकट्ठे होके. And then if the child is showing so much distress with small changes, it can even show rigidity. So again, it might not. These all symptoms are कि it gives you a pretty fair idea कब आपको assessment करानी है. अगर कुछ होगा तो the doctor will tell you otherwise, will reassure you. So these are all the play-based red flags which even the play-based school teachers can uh, detect, right? These are the signs that the child is not saying developmentally appropriate. So yes, I
Yeah,
hope I made things clear.
that is very, very lucid, and you gave a really broad thing about the red flags, and how we have to give attention to the same, and how we have to act based on that. Now, we'd like to talk about the three major signs that always warrants us.
Yeah, from the session learning, the three things that we can see even danger signs, right? That should always warrant assessment is जो हमने बार बार बात करी है, skill loss. बच्चे ने कुछ सीखा, उसके बाद he lost it. That is very very important to look for. अगर ऐसा है तो immediately parents should seek for the detailed assessment to their clinicians, right? Then it's present in the multiple domains. ऐसा नहीं कि बस घर पे था या बस स्कूल में हो रहा है. पर अगर स्कूल से भी सेम कंप्लेंट आ रही है, जस्ट फॉर एग्जांपल हाइपर एक्टिविटी, स्कूल से भी यही कंप्लेंट आ रही है, बच्चा नहीं अच्छे से बैठ रहा है, बच्चा बार बार इधर उधर बहुत ज्यादा घूम रहा है, अटेंड नहीं कर पा रहा क्लासेस, एंड सेम यू आर नोटिसिंग एट द होम ऑल्सो. किसी के फंक्शन पे लेके जा रहे हो, बच्चा अच्छे से नहीं बैठ रहा है, उस चीज में नहीं अट्यून्ड हो पा रहा है. So that is the important thing कि multiple domains में जब वो concern present है, then again you should seek assessment, detailed assessment for that particular signs and symptoms, and it is persistent over time. It's not like कि आज मेरा बच्चा बहुत behaviorally I'm talking कि आज बहुत बच्चा गुस्सा हो गया था, tantrum show कर रहा था, but is it persistent over time? Like then it should warrant assessment कि बहुत दिनों से बहुत week से ये जो सिम्टम है वो चलता आ रहा है, then you should seek a proper professional detailed assessment. These three signs I must say that we can take from this session and can spread awareness over these symptoms that should warrant assessment.
Thank you very much, Ekamji. So that was excellent. So we would like to continue the series. And so, do you have any plans on how you would like to continue the series?
Yeah. Yes, Dr. Mani. So this was just a start. We are introducing a series of child development where we will be covering neurodevelopmental disorders. Right? I'll come back to this. We will be covering neurodevelopmental disorders episode by episode. So we will be learning about what are the early identification of each disorder independently. For example, autism spectrum disorder, ADHD, specific learning disability, and so on. We'll be learning by each disorder and also what are their presentations, unique presentation, assessment, and we'll be presenting some home-based management techniques. So yes, please stay tuned with us and subscribe the YouTube channel so that you don't miss any details. And to give a short introduction to the series and to the topic that is of major need of the arts, that is neurodevelopmental disorders, right? By neurodevelopmental disorder, as per Indian Gadget, what we mean is that it is a diverse group of chronic disorders. They begin at any time during the developmental process, including the वो conception से भी start हो सकते हैं, birth से भी, and can go up to 22 years of the age, and they last throughout the lifetime. They can have difficulty in any domains like language, speech, motor skills, behavior, memory, learning, including the autism spectrum disorder, intellectual disability, and specific learning disability. Right? For example, in autism spectrum disorder, the major thing that is affected is social communication. Here it is there is symptoms and signs of restricted and repetitive patterns of either behavior or interest. And why spectrum? क्योंकि the presentation varies widely between each individual. एक autism का बच्चा might different from the another thing, right? Another child, sorry. So that's why it's called now spectrum. Each child has their unique presentation. And then ADHD, that is attention deficit hyperactivity disorder. Attention हमारी भी divert होती है, right? सबकी attention divert हो जाती है, but thing is about the regulation. So here in ADHD, it affects the attention regulation, how easily we can come back to the task, we can easily regulate our attention. Also, it includes the impulse control, the activity levels, and it can present nearly before their symptoms should be there before 12th year of age. But कई बारी miss हो जाता presentation. So with awareness, बहुत सारे individuals are getting assessed in their adulthood and getting benefits from them. Why? Because management is important in the neurodevelopmental disorders. It's not about the individual, it's about the symptoms, right? So before I end, I'll let you know about something surprising facts about the child development. So any questions before that?
Yeah, any take-home plans? Maybe you can answer that a little later, but yeah.
Yes. So then let's start with our fascinating facts about the child development. I think every parent should know. The very first is social referencing. It means your babies use your emotional reaction as a guide to understand the world, right? For example, अगर कोई भी वो नई चीज स्टार्ट करने वाले हैं, मे बी क्रॉलिंग और एनीथिंग, कोई पेट के साथ इंटरेक्शन, किसी के साथ भी, दे विल सी द इमोशनल रिएक्शन ऑफ द केयर गिवर. अगर उनको आप reassure करते हो, they see कि okay mama is happy, mama is comfortable, then they will approach that thing. अगर नहीं, if for example अगर किसी पेरेंट को ही किसी पर्टिकुलर चीज से बहुत डर लगता है, then the child get think कि ओ ये चीज डरने वाली है, राइट? कि शायद मुझे इससे बच के रहना है. So your emotional reaction is very 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 important, that guides the word actually for the child, right? And the most famous experiment done by Gibson and Box is the visual cliff experiment. इसमें क्या किया था इन्होंने? चेक बोर्ड रखे थे above the glass and over the glass to create a depth illusion, right? So the other side of the this experiment table was their mothers. तो जो mothers were pretending, smiling, अपने toys के साथ थे, खुश होकर उनको बुला रहे थे, the child actually gone, right? They crossed the cliff. And जो mothers who they look afraid, then these circumstances the child avoided to cross the cliff. So your emotional reaction are very important. We should remember it, that child is borrowing our nervous system to build their own. Then interesting fact is that second, a baby's brain produces about 1 million neural new connections every second in the first few years of life. It's very interesting. Just imagine that, how every time you talk to your child, either you read a story, play a peekaboo, sing a rhyme, or cuddle, or just respond to them with a smiley, you're helping to build those brain connections, right? So it reminds us that how everyday moments are actually brain building moments for the child. And then lastly, about the joint attention. One of the earliest signs we as a psychologist look for is the joint attention, pointing to shared interest. For example, the child see a bird first time, right, flying outside their home. They should say, or any different bird, say, जिसका नहीं इनको पता, they will say like, oh mama, look, do you see that? Oh mama, see that aeroplane, see that something. So that's very very important. Child is not just asking for the bird, he is sharing interest with you. His interest he mama will see, and that will exactly build the social communication and brain development. So yes, that's important factor. And coming, I hope you enjoyed the surprising facts about the child development. Coming back to the first question, that is the take-home message, as we discussed, we'll be talking about. The take-home message for audience is that if you feel that there is something off, right? Something off means आपने अभी सबने red flags सुने हैं समझे हैं and you think कि there's something off, you should first observe and note in the different domains. कब हो रहे हैं वो symptoms, कहाँ हो रहे हैं, कितने often हो रहे हैं, you should prepare a note. कि I'm seeing this symptom, कब से वो हो रहा है, कहाँ हो रहा है, multiple domains में हो रहा है, नहीं हो रहा, या फिर बिल्कुल वैसे नहीं समझ आ रहा, तो you can just write the example. So very first thing is observation. पहले हम identify करेंगे उस चीज को, तब भी हम manage कर सकते हैं, right? Then observe and note in the different domains. And then if you think that there is something, then go to your clinician, pediatrician, uh, child psychologist, maybe whoever is first available, just go and request a developmental screening, right? That I'm seeing this is a symptom, please guide me further. Again, right, if there's something, they will guide you, otherwise they'll just reassure you. Then ask from the caregivers, टीचर्स के साथ बात करो, फैमिली मेंबर्स के साथ बात करो कि आप भी ये चीजें ऑब्जर्व कर रहे हो इन डिफरेंट सेटिंग्स एंड एज आई एक्सप्लेन्ड इट अर्लियर आल्सो देन वी रेफर टू अ स्पेशलिस्ट जो भी डायग्नोसिस बनता है आफ्टर द प्रॉपर असेसमेंट हम स्पेशलिस्ट को रेफर करते हैं बीट ऑक्यूपेशनल थेरेपिस्ट स्पीच थेरेपिस्ट clinical psychologist play therapist and for medication pediatric developmental pediatrician or child psychiatrist so we refer their specialist if there is something there is something flat so these are the 4 pointers you may remember and lastly, you know your child best, just trust that, but don't wait. So if you have attended this webinar, then the big myth, okay, you should wait and watch, that's not a good thing. अगर आपको लग रहा है, just go to your doctor and because वो जो important time period होता है, that's a big window period for learning new skills and building. So just say neuroplasticity and everything is just speeding up.
Yeah.
So
Thank you very much, Ekam ji. So that was very, very good. So can you talk a little bit about your various specializations as well as, whatever roles you play?
yes, so I'm the founder of BAM of Mind. It's Child Development and Mental Health Clinic. Professionally, I'm a clinical psychologist and psychotherapist, as sir have introduced, RCI licensed. So here at our clinic in Mohali and Rajpura, we have multidisciplinary teams, including we have Doctor of Joes, psychiatrist, then Mrs. Japjeet, play therapist, special educators, and occupational therapists on a visit base. And along with my MPhil in clinical psychology, I have done a specialized diploma in child psychology. And as an interest, I'm very keen in learning and research about the child psychology and neuropsychology. Also, I'm very much active on social media to bust the myths around the mental health. You can follow me on the Instagram, that is Balm of Mind. And if you have any doubts further or you need the resource material for the same or anything, you can reach out to my email that is balmofmind@gmail.com. Thank you so much everyone for joining with us today and do subscribe our channel for the upcoming events.
Thank you very much, Ekam ji. It was really an eye-opener of presentation. I have not seen such a thing, ready reckoner there for, for most parents. And this is something very concise and put together in a 40-minute presentation. So I would really say it was very, very good and it was fantastic. It's really superb and fantastic and awesome. Your presentation was awesome and out of the world. Thank you very much. I really appreciate the efforts you have taken to put in this PPT and put in this talk. We thank you very much on behalf of both the channel Scepter and the Mother's Care Charitable Trust. We look forward to more interactions with you. I hope that you will join us more frequently in the coming weeks and months. Thank you very much, Ekam ji. Thanks a lot. Thanks to our viewers as well. Have a good day, and thank you very much once again.
Thank you so much, Dr. Mani, for having me. It was a pleasure to join you in today's program. We have one question from Miss Hashpreet. My nephew is 19 months old. He is responsive but doesn't speak. Should we start speech therapy? He's responsive but is not speaking. I will say that, Harshpreet, that you should seek a speech therapist or a pediatrician assessment. If there is something, they will guide you. But there is responsive. So it might be hearing तो ठीक है responsive है तो hearing का ज़्यादा issue नहीं है. But still he is not talking to बाकी developmental milestones पे assessment वो करेंगे आपके pediatrician कि बाकी जगह तो कोई दिक्कत नहीं है या फिर कोई और combining comorbid disorder तो नहीं है. According they will guide you. But yes, you should seek consultation. Thank you, Harshpreet. So yeah, thank you so much, Dr. Mani, for having me.
Yeah,
It was
thank you
great
very
talking to
much.
you today.
Thank you very much, Nikam G. So looking forward to more interactions with you, and see you more often on our channel. Thank you very much. Have a good day. Have a great day, and take care. Bye bye.
Thank you so much. Thank you so much, everyone. Have a great day ahead.
Thank you.